If you're thinking about getting implants, you must have a lot of complicated thoughts. It is actually tricky. What type to choose, if the price is right, and how to take care of, and how to do it. When you go to the dentist, your doctor will analyze and plan carefully for the operation method, treatment period, and etc. according to the condition of the patient's teeth. After all, the patient's decision is most important when choosing implants. So here are 3 helpful tips for implants. First, bone transplant. To have implants, you need to have enough healthy bones. If the loss of bones is significant, artificial bone transplant or autologous bone graft is required. There are so many types of artificial bones. At times, artificial bones do not fit well or it incurs extra cost. As DUPLO Implant employs a low-speed drilling method that uses autologous bone taken during operation, it is stable and economical without any awareness of differences and helps minimize pain and swelling. Second, around the implant. Implant surgery is important, but taking care of it afterward is also very important. A common type of implants having fastener and abutment separately can cause bacteria to penetrate into the region and lead to peri-implantitis. DUPLO Implant employs a simple wedge-type connection structure, as it is difficult for bacteria to infiltrate. The concerns about side effects that can occur during a long period of time can be reduced. Third, masticatory force. If you have implants, you must have received warnings to be very careful when having foods that require long time chewing or hard foods like ice, gum, squid, and so on. The reason is that if a constant pressure having certain pressure or over is applied to the implant, it can lead to implant fracture. As DUPLO Implant has masticatory force and side thrust suitable for Korean food culture and eating habits, the implant can be helpful for those who like to eat hard and tough food or grind teeth during sleep. Implant. If you want to use it more safely and longer, please consult with DUPLO Implant.
Patient's medical history, medication, specificity were identified through the use of a paperweight and anatomical structures, and occlusion were closely observed using diagnostic radiology equipment. Then determine the size, position, orientation of the implant to create the surgical stent and surgery planning. Perform infiltration anesthesia or block anesthesia. Make an incision using blade or flap, open after horizontal vertical incision, or try an incision flap opening using the tissue punch. After placing the selected stopper on the pilot drill and mark it on the region to be placed, identify precisely where the fixture will be placed. Use pilot drill in a full-depth pumping method until the stopper reaches the upper side of alveolar crest. Verify the gap and orientation between the teeth by initially placing paralleling pins into the hole formed in the bone. Use the depth gauge to check if the drilling has been done to the correct depth. If the hole is not formed in the correct direction, use the Linderman drill to correct the direction. Reamers should be reamed in steps of 2.5, 3.0, 3.5, 4.0, 4.5 in order up to the final diameter equal to the diameter of the fixture to be placed. After reaming, collect the bone harvested in reamer in titanium bowls. In the final reaming phase, pumping reaming is performed 3 to 4 times so that the bone chips that potentially exist inside the hole are completely removed. After forming the final hole to be placed, minimize saline flushing and suction to ensure sufficient bleeding and completely remove residual bone from the curding of the hole. There are 2 methods of fixing. The way you see now is a 2-stage implant. Remove the plastic healing plug. Connect the implant seating tip to the handle and place it after tapping. And then, Cut the plastic healing plug to the crestal level using a cutter. Fill the remaining space with the harvested bone when reaming and suture. The following is a single-stage method. Remove plastic healing plug and place tapping implant by connecting sinus abutment or MHC. Open the region where the fixture is placed using the blade or tissue punch. Remove the remaining healing plug from the fixture using remover. The ideal bone bonding must be confirmed after connecting the guide pin to the fixture and measuring the degree of bone bonding. If it is determined that bone bonding is insufficient in this process, further progress must be stopped and the fixture is removed and suture. The replacement procedure should be needed. If an ideal bone bond is identified, remove the overgrown tissue and perform bone trimming using the guide pin and sulcus reamer to form a space where the MHC or abutment will be mounted. Connect the MHC and suture the MHC into a transgingival state. After 2 to 4 weeks of secondary surgery, remove the MHC and wash the wells inside the fixture with saline solution to remove foreign substances that interfere with the perfect combination of fixture and abutment. There are indirect and direct methods for impression. Direct method uses implant PL gauge to determine the diameter, length, and post length of the abutment, considering the relationship between the antagonistic teeth and the adjacent teeth, and make a first connection with the abutment to the fixture using abutment carrier. Then, connect the abutment seating tip to the handle and bond it by tapping using the mallet. Next, indirect methods is to connect impression post of the same size to the placed fixture and take the rubber impression after connecting the plastic sleeve included in the impression post. Then connect impression post to plastic sleeve buried in rubber impression, and then create master stone model by connecting implant analog. After, select the abutment and attach it to the master stone model, considering the relationship between the antagonistic teeth and adjacent teeth, and make the final restoration through wax-up work. Crown setting includes intraoral setting and extraoral setting. First, intraoral setting is a method of applying a dental cement inside the final prosthesis produced, and then combining it into the abutment mounted inside the mouth, and then completely removing the cement which has hardened after flowing out of the margin. Extraoral setting is a method of applying a dental cement inside the final prosthesis produced, and then combining it into the abutment selected outside the mouth, and then completely removing the cement which has hardened after flowing out of the margin. Then, the combined prosthesis is selected in the most appropriate direction, considering the relationship with antagonistic teeth and the adjacent abutment, and then make a first connection with the abutment using crown forceps. In order to prevent damage to the crown after protecting the upper part of the crown by gauze, and then completes final bonding by tapping using the handle and mallet equipped with the abutment setting tip.
There are many advantages to be gained by having implants. Examples include comfortable eating, improved pronunciation, and improved oral health and confidence. However, implants are not permanent. It's hard to manage. It costs a lot. It takes a long time. DUPLO Implant considers cost effectiveness while reducing worries of long-term side effects. Helpful 3 tips. Hope it can be used as a healthy guide for choosing implants.